And my
Said that.
father, yeah, my father took me aside. He said, "Son, I don't know anything about alternative medicine, but anything that makes him that angry and mad, it can't be bad. So you stick to your guns and good luck to you."
Wow. Okay. So that's an interesting introduction to it. So for our listeners who might be new to the health benefits of fasting, can you give us like a quick overview of maybe some of the primary mechanisms of how does this help?
Yeah. So fasting is kind of the complete abstinence of all substances except water. And we do it in an environment of rest to maximize fat and minimize lean tissue loss.
Mhm.
And there's actually a number of well-demonstrated mechanisms. One is weight loss. You know,
Yeah.
people that have extra weight also have what's called extra visceral fat.
Yeah.
So about 10% of excess fat is visceral fat. Visceral fat is uh, hypertrophic. It gives off inflammatory products. It contributes to heart disease, diabetes, cancer, autoimmune diseases. These diseases that are treated as if they're completely independent entities are actually all tied to the inflammation associated with visceral fat.
Mhm.
Even though you have to see different doctors to even be diagnosed, they're not all independent, unrelated conditions.
Right, right, right.
And fasting helps preferentially mobilize visceral fat. And
Mm.
so for a person that loses 10% of their body weight fasting for a couple of weeks, they would lose 20% of their fat and as much as 40% of their visceral fat.
Mm.
So visceral fat acts like a tumor and fasting acts like it does with tumors. So when you say you want to fast and lose 10% of your body weight, you may lose 50% or 100% of your breast tumor, not necessarily linearly, because
Right,
the
right.
body's breaking things down in inverse order proportion to needs.